We received a question ahead of time. I believe this is for Trey. It is, what is the actual difference between home health and hospice? Hospice scares me. What do you tell people who think it means giving up? That's what it means to me. And that is also in the chat.
Sure. Yeah, that's a great question. And that, there's no great answer there. Hospice is a tough choice a lot of time for families or patients. You know, I try to say shouldn't think of it necessarily as given up, because you're actually by electing hospice, we should be thinking of hospice as a Medicare benefit because that's what it is. It's a service that's covered 100% by Medicare, and it's a service that seniors should utilize if they need it. I guess something I want to touch on there is when you elect hospice, you're not necessarily giving up because there's going to be a hospice medical director that's going to be a physician, and that between the hospice team and that physician, they're going to determine what are you going on to hospice for. So the classic example would be maybe someone has a cancer and it's terminal, and the oncologist has said there's no more treatment to be done here. So the hospice physician is going to say, okay, we're going to do hospice and we're going to manage this cancer. We're not going to treat it or cure it, but we're going to manage it. That individual can still see doctors that have nothing to do with the cancer. So it's you're not necessarily giving up all medical care and all treatment. But what you're going to do is for that condition, let's say that cancer, you're going to let the hospice team and the hospice physician manage that problem instead of an oncologist or a specialist. And then outside of that condition, you can still see other doctors for an unrelated condition. I can understand why, you might think you're giving up there, but that's really why, it shouldn't be something you just sign up for quickly, I should say. There should be extensive conversation between your primary care doctor, the hospice physician, even before you sign on to service, the hospice team. The hospice team's likely going to have some kind of community liaison that should be sitting down with you and explaining all of this before you sign any kind of papers. Absolutely recommend doing that. And the person that's electing hospice should be confident that that's the level of care that they want. And again, it shouldn't be an overnight decision. You should consult multiple parties, consult family, consult your doctors, consult the hospice team, maybe even interview a couple different hospices. I think Zach brought up a great point that, there are a lot of organizations out there that are not necessarily following the rules or may not be adhering to the guidelines that Medicare and the state have put into place. So the CMS website, cms.gov, has a lookup tool for home health and hospice agencies. And you can type in any agency name in there, and it will pull up their public star rating. Medicare publishes a star rating, and it will publish the patient surveys. So anybody on home health or hospice will get a survey from Medicare sent to the family, like basically how well did that company do? And all of that is public and on the CMS website. So that's an easy way to vet whether you're going with a good organization. Hopefully that answers the question there. But I think what it really comes down to is it's something that should be considered over, several days, maybe. Don't jump into it quickly. Consult all the different parties. Really make sure that's the service you want to go with. The hospice team, whoever you're going with, should be educating you on all these things before you sign any papers. And then, by the time you do sign those papers, sign up, you should feel confident that hospice is the service that you want. And it really is a good service for those who need it. You get medical care at home. They can bring equipment in the home. They can bring a CNA into the home to do bathing. You have access to that hospice physician if any problems come up, and you can treat a lot of those problems at home, like we've said, age in place, instead of having to go to doctor 1, 2, 3, 4, hospital, emergency room, all of those things.